Hi everyone, my name is Gregory. Today I would like to share with you the case I finished yesterday. It's a full rehabilitation case in Cerec. So this patient came to me in 2007, and when he first introduced himself, and by looking at his x-rays, I see like a disaster. We see a lot of infection on his lower right side, a lot of infection on lower left side, and failed all the restorative parts in his mouth, and also the root canals. So at the beginning, yes, I was a little bit skeptical. Will this patient understand his the problem? So he also was skeptical when I told him that a lot of restoration failed and a lot of infection. He didn't feel anything. He didn't have any complaints, but he wondered what can be done to probably to restore his arch. At the beginning, he asked me just to do crowns on his lower right side and put the bridge on his lower left side. Even number 18 was almost a class 3 mobility, and so by sitting with him and explaining him that the risk factors, not just the money factors, but the risk factors what he has, so the patient slowly understands what his priority is and why we have to start working on his teeth. So the first I explained to him that if we have to do some of the restorative stage here, we have to probably do like a full rehabilitation case, and explain to him how it works. The patient, he's on insurance based, and he wants to do it, but it's not his priority. He's old man, and say he doesn't want to do all this cosmetic work, correcting his bite, since he doesn't have any complaints. So I came to this approach this case a little bit different. So as we know that from the bite point, he is all right. He doesn't have any problems. He doesn't have any symptoms. So trying to keep his MIP or vertical dimension almost the same, because I'm not going to change. And we start based on his insurance, how much they have a coverage, so the patient can afford and at least finish the case. As I said, we started this case in 2007, and I referred him to oral surgeon to extract those wisdom teeth and hopeless teeth on both sides, and do the socket grafting and the implants placement. So the patient starts slowly doing what he was told and followed the treatment. He was very compliant, and to my surprise. And the another picture is 2012. You can see that the implant has been placed and the restorative stage been done. Some root canals been redone, and some of the new root canals. Restorative stage at the front. But again, it's I gave him a credit because he understood the treatments, he understood the risk factors he is involved, and slowly he can see his transformation while he's doing all this dental work. You can see also that my progress as a Cerec doctor, I became a Cerec doctor from 2007. You see some restorative stage when I was in the red cam, now it's blue cam, and I can see my transformation as a dentist, also how I started this case, and how to approach the case, how my preps are, and also what my restorations look like after 5 years of experience. So the last two cases I want to share with you. So when I'm done with this patient, you can see he's on crossbite, severe crossbite, and it was very difficult for me to restore his implants and do the nice crowns. So we're doing the last two cases on tooth number 29 and will be number 15. You can see that he has a failed amalgam restoration. There's a cavity on the mesial also, and I have to prepare this tooth to make sure it's I'll try to save as much of tooth structure. I want to make sure that the tooth structure will overlift my restorative stage, not the restoration overlift my tooth structure. So I want to make sure that I remove as little as possible from a tooth, and try to keep as much as I could. So this case, I was trying probably to do a little bit creative, and instead of by generic copy, I've been doing by generic individual. It was a little bit challenge for me, and this is my prep. You can see it's a shallow, that just cervical part of 49. So make sure I have a little bit like a borderline where my margin has supposed to be. I always use my period probe to make sure where the bone is. So make sure the biological weights are not violated, and make sure it's I'm not violating anything restoratively. So I try to keep enamel border right here, ring, so make sure I have a better bonding to structure. This is from a cervical view. You can see I have enough clearance here, and this is final restorative. This is a deep insertion, and it's 1 week after. You can see the hard tissue heal fast, and again, I didn't violate any biological weights. Looks perfect. Closed everything, removed all the decay. But again, it was a little bit challenge for me to do restoratively. I was, I had time. So let me play with it. Can I do something, not just by generic copy? So the another case is we start doing number 15, and this is a case. You can see that from the buccal view that I have enough space, and if number 15 would not have any decay, I would probably just do like an onlay to bring this tooth to the occlusion. But since there's amalgam filling failed and there's a cavity on the distal, I have to prep this tooth to make sure it's removed all the decay before bring the restorative part of it. So what I also see is when I start restoring this case, and you see how the shallow my box is, when you do restorative part with the Cerec, it doesn't give you a nice emergence profile. So in this case, sometimes you have to probably increase the box width, I mean, to make more flow of the restorative walls. But again, once again, it's not cosmetic tools that I have to worry about, and the patient is not, again, it's not asking anything else. So I prepped the tooth as much as I could to keep enamel ring also available, remove the decay, and this is the final stage. So this is the restoration. I've been using like Emax in this case. You can see this, there is no gaps, and this is how it looks in the patient's mouth. So this was the last restorative stage from a Cerec view. It has some small cavities and a cervical, and I have to just work on it, and a little bit number 10, I'm sorry, incisal edge. But you can see that's my dentistry within 5 years, and you can see it was some good restorative part, it's some of the bad, but that's what my experience with the Cerec for 5 years. This is the low arch. You can see again it's the implant crowns here, this implant crowns over here, and also some of the Cerec restoration, and this is MIP. So you can see also that's how much crossbite he has. It would challenge I've been having restoratively, and the patient's happy, I'm happy, and thank you for listening.